Hello everyone, Dr. Fink here, and today we will talk about different testosterone preparations. So when you need testosterone replacement therapy, usually there's only one recommendation by your physician or your healthcare professional, and you basically go with that. But nowadays, there has been a lot of development in the testosterone medication field, and there's a variety of testosterone preparations out there that can help you with managing side effects. Okay, so there's different types of testosterone, and each has different benefits and different side effects. Even though the drug itself is testosterone, depending on the preparation, the side effect can be different. So if you need testosterone replacement therapy and you're afraid of some side effects, this video is perfect for you, because I'm going to break down several types of testosterone preparations, which side effects they have, which one is better for whom, with what type of conditions, and I will also compare them between each other. All right, so let's get started. So I think we should make a big differentiation first between long-acting and short-acting testosterone preparations. Long-acting means you can take the preparation, inject it one time, and then you're good for 1 week, 2 week, 3, etc. Okay, so this is long-acting. Short-acting testosterone would be something you need to take daily. Okay, so first we have the long-acting testosterone. Long-acting testosterone is our traditional testosterone. We have, especially here in the US, we have testosterone cypionate and enanthate. So what does cypionate and enanthate mean? This is simply the name of the ester that is attached to testosterone. And this, once testosterone is injected, it will detach from this ester and slowly trickle into your bloodstream. That's why if we inject cypionate or enanthate, we don't have to inject it every day. It will reach a peak 2 or 3 days after injection and then slowly go down. Okay, so this can reach the basal levels in about 1 week, depending on the dosage and the individual. Usually it is prescribed to inject once every week or once every 2 weeks, or sometimes even once every 3 weeks. I see that the baseline value is reached pretty much after 7 days. So I wouldn't recommend going anywhere above once per week, just to keep stable levels. Otherwise, in some cases, you will even go lower than your baseline, and this is not the point of testosterone replacement therapy. Another long-acting preparation is testosterone undecanoate, which is a very long-acting testosterone preparation, and here you only need 1 injection every 3 months. So this is a lot of liquid injected, and it will last you a whopping 3 months. Okay, and the levels should be more or less stable. However, this medication is oftentimes not covered by health insurances and might be very pricey in some cases. Testosterone cypionate and enanthate usually are covered by health insurances and are very cheap if you have a good coverage. Okay, so we're talking $10, $20 per month for testosterone cypionate and enanthate, depending on where you live. So now we covered the long-acting testosterone preparations. Now let's look at the short-acting testosterone preparation. So short-acting, we have oral undecanoate preparation. I will not mention the brand names, but it is an oral form, so we take it as a pill form of testosterone undecanoate. And testosterone has been developed as a pill way back in the days, and there has been very harsh side effects because it was bypassing the liver, and in the liver the testosterone pills would cause a lot of toxicity. That's why it has been mostly discontinued. However, this new oral undecanoate formulation is directly absorbed by the lymphatic system. So it bypasses the liver, so there's no liver toxicity with this product. It directly is absorbed by the lymphatic system. All right, so this is a big benefit. There's no side effects on the liver with this oral testosterone. And however, you need to take it 2 or 3 times per day, just as somebody who's taking their supplements in the morning or in the evening, etc. Okay. Now we have also the testosterone cream or gel, which is topically applied to the skin and absorbed by the skin. And this one also, you would need 2 to 3 times per day for the application. Remember, it is a short-acting testosterone, so your levels, so let's say this is 1 day. So your levels peak, then they go down, then you have to take it again and again. Okay, so it is very short lived. So 2 or 3 applications per day are necessary to keep average or higher testosterone levels. And this can be a burden for some patients, and especially with topical gel, it is not fun to rub gel on your body 2 or 3 times per day, and it can also cause cross-contamination when you hug or touch somebody, and the location you had the testosterone gel can transfer to that person. So those are the downside of testosterone gel. Then most recently, nasal preparations have been developed. Nasal gel, nasal spray also 2 or 3 times per day. And here it is just pushed inside of the nostrils, and it is also very short-lived, so we need 2 or 3 applications daily. So here we have the long-acting and the short-acting testosterone preparations. And for the side effects, for long-acting preparations, we have, especially once we inject, we reach this higher level, because we only inject once per week. So the level will go oftentimes supraphysiological, meaning it is above average healthy levels. And this will last maybe 1 or 2 days. And in those ranges, we are prone to develop side effects, such as gynecomastia or increase in hematocrit, red blood cells. So we know that testosterone increases red blood cells. So this is also a side effect seen oftentimes with long-acting testosterone preparations, and also infertility. Okay, so remember, we have this negative feedback to our brain when we take exogenous testosterone. We sense that and we stop producing. And the more at once we take, the harder the shutdown process is. And if we inject only once every week or 2 weeks, this shutdown process reaction will be pretty harsh, and infertility can occur easily. And gynecomastia is basically the growth of female breast tissue in males, and this is caused via aromatization of testosterone. Testosterone undergoes aromatization, and it's basically converted into estrogen, which is the female hormone, and this can cause the buildup of female breast tissue. So these side effects are also seen in testosterone undecanoate injectable, and So these are basically the main side effects of long-acting testosterone preparations. For short-acting testosterone preparations, we can also have increase in hematocrit, even gynecomastia, but it's not as prevalent, and infertility also. But remember, the dosage we take is much less than the ones we take for the long-acting at once. So we are mainly in the healthy average levels of testosterone without reaching above the supraphysiological levels. So those side effects should be somewhat weaker than in the longer acting testosterone preparations. All right, so this is it for the several types of testosterone medications, but there is also an indirect way to replace your own testosterone. There's something called, right here on top, HCG, which is basically human chorionic gonadotropin. What HCG does, it is, so fast forward, in our brain we release gonadotropin releasing hormones, which include luteinizing hormone. Luteinizing hormone activates testosterone production in the testicles. And this HCG is mimicking the effects of the luteinizing hormone, of LH. So we basically trick our body to produce more of our own, of our endogenous testosterone. And this is very powerful if fertility issues are taken into consideration. So if somebody wants to have children in the future and needs testosterone replacement therapy, then in some cases HCG can help that individual to trigger more of their own production. And the beauty of it is we self-regulate. Okay, if we inject testosterone from the outside, we can inject a lot or we can inject a little bit. And depending on what we injected, that's the level we have. With HCG, we inject HCG, and it doesn't really matter of how much HCG. Of course, if you go crazy level, it might somewhat influence it, but usually the level of HCG is not that important, and it will stimulate exactly the right amount of testosterone we need. Okay, so it's a self-regulating effect via the HCG injection. However, patients with low testosterone where we have a primary hypogonadism, so where the problem lies in the testes and not in the brain for testosterone production, cannot benefit from HCG. HCG is only for low testosterone patients who have a secondary hypogonadism, meaning that the hypothalamus pituitary axis is impaired. And by replacing the gonadotropin releasing hormone, which should be released by the pituitary, then we can trick our body to produce more testosterone. So this is a very powerful way to replace the testosterone in a healthy way, and you produce more of your own testosterone without having to shut down your own production. Okay, so I hope this was helpful, and thank you so much.